What should patient know about the risk of graft-versus-host disease or GvHD after allogeneic stem cell transplantation? This is an important topic for anyone considering or undergoing an allogeneic stem cell transplant. Hearing about graft-versus-host disease or GvHD can be frightening, but understanding what it is and what can be done about it can help patients and families feel more informed and prepared. So first, what is GvHD? In an allogeneic stem cell transplant, the stem cells come from another person, the donor. These donor cells help rebuild the blood and the immune system of the patient who is the recipient. As the new immune system develops, it may sometimes recognize parts of the patient's body as different and attack them. This reaction is called GvHD. And GvHD can affect different organs, most commonly the skin, the liver, the eyes, mouth, lungs, and the digestive tract. But there are two main forms of GvHD. Acute GvHD, which usually occurs during the first few months after transplant, and chronic GvHD, which can develop later and may last for months or even years. Now, an important point I would like to highlight: not every patient develops GvHD. Many factors influence the risk, including the type of donor, the degree of donor matching, the patient's age, and the transplant strategy used by the medical team. Even when GvHD occurs, it can also vary greatly in severity. Some patients experience mild symptoms that are manageable with treatment, while others may develop more serious complications requiring intensive care and long-term follow-up. The good news is that transplant medicine has made tremendous progress. Today, transplant teams use sophisticated donor selection methods, preventive medications, and close monitoring to reduce the risk of GvHD. In recent years, new approaches have significantly improved outcomes, allowing more patients to undergo transplantation safely. But patients also play a crucial role. It is important to report any new symptoms promptly: a rash, diarrhea, persistent nausea, jaundice, dry eyes, mouth discomfort, shortness of breath, or changes in skin flexibility should never be ignored. Early recognition often leads to more effective treatment. Another reassuring message is that many effective therapies are now available. Over the last decade, several new treatments have expanded the options for patients whose GvHD does not respond to standard therapies. Finally, remember that transplantation is always a balance. While donor immune cells can cause GvHD, they can also help eliminate residual cancer or leukemia cells. And this beneficial effect is known as the graft versus leukemia or graft versus tumor effect, and is one of the reasons allogeneic transplantation can be so effective. The key message is simple: GvHD is a well-known complication of allogeneic stem cell transplantation, but it is increasingly preventable, detectable, and treatable. Close communication with your transplant team remains the best way to protect your health and achieve the best possible outcome.